In the latest CDC National Sexual Transmitted Report, the United States reported more than 2.2 million reported cases of chlamydia, gonorrhea, and syphilis combined. Even though that was a 9% decline from 2023, the overall sexual transmitted infection burden is still 13% higher than a decade ago. Sexual transmitted infections are still a major public health issue in 2026, even though with some improvements, sexual health is more than just sex. It's about your body, your mind, your choice, your safety, and your future. In a world full of misinformation, silence, and confusion, many people are still making life changing decisions without the proper knowledge they truly need. Join us on our Way Out of Domestic Violence podcast as we sit down with Dr. Nicole Jackson for an important conversation on sexual health in 2026. As infections and diseases continue to rise, Dr. Johnson will answer key questions that will bring wisdom, clarity, and insight on how to approach sexual health with the knowledge, awareness, and responsibility. You don't want to miss it.
You find out about something and you treat it before the other partner is affected, and now you're able to start from a clean slate. And that primary care is to try to pick up on things early so that it doesn't become a systemic issue. And so sometimes something that we can treat, it's much better to know now than to wait until you have symptoms. And then at that point, it could be much more difficult to treat or potentially life-threatening. So I think knowledge is power when it comes to aware of your own behaviors, but also being aware of your partner's behaviors. Because unfortunately, I've had a lot of patients that may have gotten an STD where it was their partner that was the risky one. And they may have been aware or they may not have been aware. So that's why I think the conversation is so important. So at least you know how to protect yourself. Yeah.
Wow. There's just a lot going on.
As much conversation as possible. I know safety can be, because sometimes there's the dynamic where it might be abusive, you know. There's a couple different options. One, that there are female condoms. So, you know, male condoms where you put the condom on the man and that's dependent on him using it. But the female condom, the women, we insert it into the vagina and that provides a layer of protection.
So you said
So there are female condoms, and not everybody knows, because male condoms tend to be more accessible, but female condoms do exist. There is also something called PrEP, which is HIV pre-exposure prophylaxis. There's actually medication available if you're someone, say you might be in a relationship with someone that does have HIV, or you're in a relationship with somebody that normalize testing is just something that we do just to check in, you know, you're eating well, you know, let's just make sure that the cholesterol is good, make sure there's no diabetes. And if there is something, we can address it. But I think just like incorporating that into your usual wellness check.
And what would you say to a young?
Especially when people get defensive, you know, it's like, hi, I see that you're getting.
So you wouldn't rule that out as a red flag?
I think it is a red flag, definitely.
Okay.
I definitely think it's a red flag. But I like to probe.
Right.
Because to see what is it about this that is.
What scares you?
Yeah, because some people might say, oh, you don't trust me. It's like, well, I think it's just.
No, I don't trust you. I'm just getting to know you.
Exactly. I definitely don't think that it's wise to get into a new relationship if you haven't had testing. So I do think it's a red flag. But I always like to get a sense of why, because whenever we have a reaction, sometimes it might be fear, you know, but sometimes there might be something like, you know, maybe they are promiscuous, for example, and don't, you know, as a primary care doctor, I really believe prevention is important. But I literally have met patients that I meet them in their 60s and they said, you're the first doctor I've seen in 40 years. Because they only would go to the doctor if they didn't feel well. Some people just didn't, and some people may have grown up where they didn't have health insurance. So like their interaction with healthcare system was when they were sick. So I think we as a society need to get more on the perspective of prevention and really just going just to get checkups, because that is where we find a lot of things, not just when you're sick. I mean, we can take care of the acute thing. Then what about the thing that's been lingering all this time and you didn't know about? But I do think a lot of people just don't have that mindset, or they think that they are invincible, you know, again, because they're very, they are willing to take risks and don't see the value of prevention. Because from a lot of people's perspective, it's like, why go to the doctor if I'm feeling fine. So I think that's why the education is so important, because a lot of things that I see in primary care are things that you don't have symptoms for, but have pretty big consequences if they go undiagnosed for a very long time and untreated. So